All seen those medicine commercials with the long list of side effects that's connected to a common medicine, but some of these effects are harder to catch than others. Here to shed some light on this subject this morning is Dr. Quinn. Good morning, Dr. Quinn.
Good morning.
So, I know, just like we said, those medicine commercials where it tells you all the good things about the medicine, but then it seems like there's a list of side effects a mile long before the commercial ends. So, tell us a little bit more about that, about these side effects.
Well, the deal with the side effects is the earlier you catch them in the progression, the better results 99.9% of the time. And the way we do this is we do blood work. A lot of patients don't like to get their labs done when they come in for refills on their medications, such as their blood pressure, cholesterol, or whatever medication it is. But we explain to them that doing the blood work, it allows us to see things before they even develop symptoms in most cases. And maybe we could switch to something else, and that the blood level that was incorrect would go back correct, and then that person would be safe.
So with the blood work, go over briefly the benefits of blood work, because I'll be honest with you, I'm one of those people, I don't like getting the jab in the arm either. But just, I guess, hit home the emphasis that's on this blood work, and just what are the main benefits that you notice from that?
Well, what I noticed over 23 years of being a primary care physician is a lot of people might be on certain medications like blood pressure, diabetes, or cholesterol, and when we do the blood work, we're looking for certain things. We're looking at the kidney enzymes to make sure that they're stable. Like the last lady I just saw, her kidney enzymes were very low, meaning her GFR, glomerular filtration rate. So we told her we were going to refer her to the nephrologist, and she was like, "Why are you doing that?" I said, "Because your kidney enzymes were low, and we want to get on it early to see if there are any changes that need to be done to your medicine, or is there any type of treatment they can do as a specialist so that you won't end up on dialysis." So this is just one example of many where doing blood work allows us to catch things early before the patient, in a lot of cases, has no symptoms, and the corrective actions are implemented so that that person does not deteriorate in regard to their health.
So with the blood work, the ultimate danger here is if you don't get that blood work done, a lot of times you're not going to catch it in early enough time to keep from facing major side effects or major effects from it. But if you do get the testing done, you can catch it and treat it early. Is that what I'm hearing right?
That is correct. And it's just like we talk about cancer. You catch it early, your outcome is much better 99.9% of the time. And with blood work, it's the same thing. Like, we don't want the lady to go on dialysis where her life is very compromised, where she has to go 3 days a week, which could, dialysis could actually take your life.
Right, and as you've really emphasized today, you've seen many examples in your practice of people who you've caught you've caught it by doing the blood work before you even see the effect. So ultimately, the blood work is the way to go. Always better to be safe than sorry, right?
Right.
All right.
So don't beat Dr. Quinn up when we tell you you have to do your blood work, because a lot of people, they want to get into a boxing match, and I don't want to fight.